Diarrhea is the condition wherein frequent passage of loose, watery stool occurs. Diarrhea can be defined as absolute or relative diarrhea. Absolute diarrhea is the occurrence of more than 5 bowel movements a day. Relative diarrhea is the unusual increase in the number of bowel movements in comparison to an individual's usual bowel habits. The types of diarrhea according to severity are acute diarrhea, chronic diarrhea. Acute diarrhea is a type of diarrhea that usually lasts a day or two and heals on its own. Acute diarrhea is most commonly caused by infection, which can be viral, bacterial, or parasitic. Certain medications can also cause diarrhea. Diarrhea that lasts for at least 4 weeks is termed as chronic diarrhea. Chronic diarrhea is commonly caused by a functional disorder such as irritable bowel syndrome, infectious diseases, an inflammatory bowel disease such as Crohn's disease, colon cancer, a recent abdominal surgery, severe constipation, carbohydrate or fat malabsorption, endocrine system malfunction, or abuse of laxatives. Diarrhea usually starts with crampy abdominal pain followed by frequent passage of loose stool. Diarrhea with an infectious origin may also experience such symptoms with the addition of fever, loss of appetite, vomiting, weight loss and dehydration. Complications of diarrhea can be dehydration, electrolyte imbalance, and irritation of the anus. Diarrhea is usually treated with frequent and sufficient fluid intake. If necessary, oral rehydration solutions, or in severe cases, intravenous fluids administration to prevent dehydration. For adults, medications such as anti-motility medications can be used to relieve the symptoms. However, in cases such as bloody diarrhea, these medications are not advised. In that case, antibiotics may be necessary, which are prescribed by a physician. Furthermore, it is important to visit a physician when you have severe diarrhea after or during a visit to the tropics. Diarrhea is preventable, and here are some of the things you can do to avoid it. Washing your hands is by far the most effective way of protecting yourself, not only from diarrhea but other diseases as well. Clean every surface that will come in contact with your food. Do not drink unpasteurized milk or milk products. Avoid eating raw fruits and vegetables unless peeled or thoroughly washed. Do not eat meat or shellfish served cold. Stay away from eating street foods. Your general practitioner can give you more information about the disorder and its possible treatments.